Welcome back to my follow-up video for my anterior lumbar interbody fusion surgery for day 30. I did a couple of updates in earlier episodes, and I wanted to do an update today to talk about my experience in healing and where I'm at now. I want to talk about my initial recovery and physical therapy and rehabilitation, some personal well-being just physically and mentally, and then talk about advice for others, someone else who's planning to go through this themselves. If you watched any of my earlier videos, you've seen some progress and information. I wanted to talk at greater length. In speaking with my neurologist, we decided to do an anterior lumbar interbody fusion. It's a surgery that goes through the front, and they went in and wedged open the space where the disc was collapsed, cleaned out the pieces of the disc, prepped the bone surface, and put a spacer in, and also put a plate with some screws. And it was all done through an incision in the front that was just a couple of inches long. I spent one night in the hospital. I was prescribed pain medication. I wear a brace. I came home with a walker and a toilet riser. And so for the last 30 days, I've progressed from taking the pain medication to eventually just having some Tylenol only to no pain medication now for about 2 weeks. As I was feeling better and my days were better, I was able to walk more, get up and move. You can see here that my steps more or less increased every day on my fitness tracker, and walking has become easier the more that I do it. My pain level here at day 30 has been the same for probably the last 10 days. 2 of the last 10 days I've woken up with a little bit of nerve pain down my leg, but walking has helped that subside. Move. But even if you can't walk on the treadmill, just find a place to get up and walk. I did a prior video where I just walked around from one edge of the house to the other. And it's better than nothing, and I think it's vitally important to get up. And though I still have some pressure type of sensation in my lower back, I do not have pain, and I have not had what I would call back pain or surgery pain or incision pain for 2 full weeks now. My mobility has improved greatly, partially because of the walking that I'm doing and just time passing since surgery. I'm able to stand up and sit down with relative ease, keeping sure that my back is straight. I'm able to walk. I went down 2 flights of stairs today. I have climbed stairs, and I've gone down a few steps here at the house, but I went down 2 flights of stairs today, holding onto the rails with no walking sticks. I'm able to sit on the couch and get up and down with relative ease, and I'm still using the toilet riser on a lower setting, and I'm able to use that with ease. I was also able to use the facilities in the restroom at work. I'm lucky to say there have been no real setbacks other than a nerve pain here and there in the morning, probably twice in the last 10 days. But it has been overall very successful, and I've been improving every day. I wanted to address physical therapy and being active a little more than just walking. I believe, as I've said before, that getting up and walking is a valuable part of getting blood flow and oxygen in the blood. I was sent home with a packet of papers that had some very limited and basic exercises, such as lying on your back and dragging one foot up to the bent knee position and then straightening that leg out till both feet were then straight, legs were straight again. Also, some isometric exercises, tightening the stomach, tightening the thighs, tightening the buttocks. So I did the isometrics and I did the leg drags, and I was very careful with my body posture and positioning. I'll talk about it in a moment, but I have a follow-up with my neurosurgeon this week, and I'll hear about more physical therapy if he's going to prescribe something professional. I want to talk a little bit about my well-being and mentally and physically, and part of that is also going to be some nutrition and movement and physical activity related, because I think they're all related. It was important to me to get off of the heavy painkillers as soon as possible. I think I mentioned it in a prior video, but I was a little aggressive with that, and I wished I would have had a little more patience. But I did not want to drag out taking heavy-duty pain medications. I also wanted to make it a goal to get on my feet and moving as quick as possible, and that's helped my recovery as well. I also wanted to make it a goal to get up on my feet and moving as quick as possible, and that's helped my well-being also. It's winter now, and some of the challenges have been cabin fever, quite frankly, being inside and not being able to be outside during the first 22 days post-surgery. I was, with the weather and with the slick surfaces outside, I didn't feel comfortable except 2 days, days 18 and days 19, when I was able to go out, and you saw my prior episodes, just do a little bit of walking. I think my mental health and physical well-being have been improved by some good supplementation. From a prior video, you remember I'm taking vitamin D, and I'm also taking some heavy calcium bone builder to help my spine fuse, and I'm using just some greens and some collagen and some protein powder in a daily smoothie. As far as coping with those things that I couldn't address and couldn't handle, I'm fortunate. I have a good safety and support system that I could rely on daily for some help. If you don't have that, please involve a family member or a friend, or find somebody that you can call at a moment's notice if you need help, so that you can be able to be a little bit more mobile and walk a little more and get up and be just a little bit more independent each day. Regarding healthcare follow-up and communication with the medical team, I reached out once to go return part-time to work at home, and the second time to return full-time to work. But the doctor's office hasn't really reached out to me. They left that in my hands on an as-needed basis, if I needed help, if I needed medication, or if I had any issues. So they haven't been proactive as far as reaching out to me, but I have their information, and that hasn't bothered me. Day 34, I will have my follow-up appointment with the neurosurgeon and be able to visit and discuss my progress, and like mentioned earlier, if there's any physical therapy that I'll be doing. My personal takeaways from my process and my preparation and the surgery and the healing is I would have done it earlier. I wish I would have done this 5 years ago, 6 years ago, after I had my initial injury. I talked in an earlier video how I didn't feel like I was living my full life, and I was giving things up due to mobility and pain and worry about my back being out. And I've had such a good result that I wished I would have done this before. If you have the leave and the good medical care and the support system, I would suggest not putting off surgery if you can avoid it. Consult your physician and find out what's best for you. You can see here that I've transitioned from walking around from one end of the house to the other, and even on days 18 and 19, being able to get out and walk in the driveway and have a little bit of fresh air. You can see here that I'm able to get on a treadmill just in the last couple of days and get some steps in that way. It's better than walking back and forth across the house, and it's giving me the opportunity to walk a little bit further. Notice I'm being very careful. I have my brace on. I'm wearing appropriate footwear. and I'm going at a very manageable speed so as not to rotate my hips too much or to bounce up and down too much or to put any pressure on my lower back. It's important to walk at your own pace, something that you're comfortable with, and for a distance that doesn't irritate your lower back but can help the heart rate pump blood and help your body heal. It's good for your body and your mental health to get up and to be active.